Miss Smith. I'm Thea. I'm gonna be your nurse today. How are you doing?
Good. How are you?
Is it okay if I have a seat right here?
Mm-hmm.
So what brings you in today?
Just came in for my wellness exam.
Okay. Before we get started, can you tell me your full name and date of birth?
It's Laura Alexander Smith,
Okay.
and then February 8th, 1996.
Okay. So I'm gonna ask you a bunch of questions. You probably heard it all before, and you get it every time you come in, but we have to.
Okay.
So, what? Are you married?
Mm-hmm.
Okay. Have you been divorced?
Twice.
Okay. What's your highest level of education?
My bachelor's from college.
Okay. What do you do?
I'm a teacher.
Okay. What's your religious preference?
Just Baptist.
Baptist. When was your last wellness?
Last year.
Last year. What immunizations have you had?
I've had my flu, pneumonia, and then just the other regular ones you have to have through school.
You got your chicken pox?
Mm-hmm.
Okay. Have you had your hepatitis?
Mhm.
Okay. Is your tetanus up to date?
I think so.
Okay. Can you tell me your past medical history? Like things you've been diagnosed with?
Oh, okay. Just hypertension, diabetes.
Mm-hmm.
I think that's about it. Just those two.
Okay. Have you had any surgeries?
I had left wrist surgery. I had my appendix taken out. And then just little things like my wisdom teeth.
Okay. When did you have your appendix taken out?
When I was like 10.
Okay. When did you have the wrist surgery?
Probably about 16.
Okay. Have you had any other kind of hospitalizations?
Just when I was 16 after I wrecked my car, that's how I broke my wrist.
Okay.
I only stayed for like 2 days.
Have you ever had a blood transfusion? Okay. So, do you take any medications?
I take metformin.
How much and how often?
I think it's 500 and twice a day. And then I take Coreg.
How much do you take?
It's 6.25, I think. And I take it twice a day too.
Do you take them like you're supposed to?
Twice a day.
Twice a day? You take them twice a day?
Yeah. More than enough.
Do you have any allergies?
Mm-mm.
Do you have any like seasonal allergies or anything like pollen, dander, cats?
Mm-hmm.
Pollen. Are you allergic to any food?
Just peanuts.
Peanuts? What happens?
My face swells up.
So you have an anaphylactic reaction.
Mm-hmm.
Do you carry an EpiPen?
Mm-hmm.
Okay. Sorry, I'm doing so much writing. We have to document all this. So I'm gonna ask you some questions.
Okay.
Some more questions, even though I've already asked you some. How would you describe your exercise level? Sedentary, mild, occasional vigorous exercise, or regular vigorous?
I guess. Mild.
Mild? Okay. You just walk and stuff like that.
Mm-hmm.
Do you follow a diet for your diabetes? You just eat whatever you want to?
Mm-hmm.
Do you check your blood sugar regularly?
Every day.
Every day? What does it normally run?
Like low 200s. A little on the higher side.
Yeah. Have you been to your doctor recently about this?
Mm-mm.
Low 200s?
Mm-hmm.
Okay.
They tell me I'm just a little sweet.
You're a little bit more than just a little bit.
Just a little bit.
Do you eat a lot of fat?
Mm-hmm.
A lot of salt?
Mm-hmm. Lots of salt.
Do you drink caffeine? How much would you say you drink a day?
Like 3 cups a day.
3 cups of coffee?
Mm-hmm.
Do you drink sodas?
Oh yeah. I like some Dr. Pepper.
How many Dr. Peppers?
It's a lot.
What's a lot?
Like 4 or 5.
No tea?
Nah.
Do you drink?
Mm-hmm. I'm a
How-
teacher, I have to.
How often do you drink?
Probably like 3 times a week.
What do you drink when you drink?
Wine.
How much?
Sometimes hard liquor, but mainly wine. Maybe like a glass.
Glass. Have you ever considered stopping?
No.
Do you experience blackouts?
Mm-mm.
Do you binge drink?
Mm-mm. In
You
my
drive?
college years, sure, but not anymore.
Do you
We
drive
got
after
past all that.
drinking?
Mm-mm. That's what Uber's for. I got the app.
Good. Responsibility.
Sometimes my husband will come get me too.
Well, it's very supportive of them.
Yep.
Do you smoke?
Nope.
Okay. Do you use any recreational drugs?
Mm-mm.
When was your last menstrual period?
2 weeks ago.
Is it regular?
Mm-hmm.
Do you do a breast exam regularly?
Mm-hmm. The
Once a
thing
month?
where you go like up under your armpit.
No
all
lumps,
around?
pain, or
Mm-mm.
anything? Okay. Have you been pregnant?
Nope.
You live with your husband?
Mm-hmm.
No falls recently or hearing problems?
Mm-hmm.
Do you have an advance directive or a living will?
Nope.
Do you feel safe in your household?
Mm-hmm.
No abuse or anything like that?
Mm-mm. I have guns for
Okay.
that if I need it.
So what, did your father or your mother have any medical problems?
My mom has hypertension,
Okay.
and my dad has COPD.
Do you have any siblings?
I'm an only child.
Do you have any, you don't have children. Did your maternal grandmother have any?
I think that she just had heart problems too, but I couldn't tell you what kind. Like CHF, I think.
I'll be done in a second.
Okay. Did your mom's grandfather have any problems?
I think he had diabetes.
Did your father's grandmother have any problems?
I know that she had hypertension.
And did your did your father's grandfather have any problems?
Not that I know of.
Okay. Is stress a big problem for you?
Mm-hmm.
Do you feel depressed?
No.
How do you handle your stress?
I usually just watch TV. Sometimes that glass of wine helps.
Okay. Have you thought about using a more positive approach to your stress?
Like,
Exercising.
yeah, that'd probably be important, wouldn't it?
It'd be good for your diabetes and your hypertension.
Probably.
It's something that we could look into later on today.
Sure. You know, I
Do you
think
have any
my
problems?
watch counts my steps, so we should probably start
Yeah.
doing that.
Do you have any problems with your appetite?
Mm-mm.
No problems eating?
No.
Okay. Have you ever attempted suicide or thought about hurting yourself?
Mm-mm.
Do you have trouble sleeping?
Nope.
Have you ever been to a counselor?
Mm-mm.
Do you panic when you feel stressed?
Mm-mm.
Okay. How long does your period normally last for? I'm sorry.
Like a week.
Do you have any difficult, hang on, I'll skip that for now. Have you had any recent fever or chills, nausea, vomiting, or fatigue?
Mm-mm.
Or recent change in weight?
I've lost weight.
How much have you lost?
5 pounds.
5 pounds over how long?
Probably like a month.
Do you have any difficulty swallowing?
Mm-mm.
Earaches?
Nope.
Any loss of hearing? Loss of smell? Do you mean loss of taste?
Mm-mm.
Do you have any dental problems like painful chewing?
I got this one tooth that hurts,
Okay.
but that's it.
Okay. Do you have any ringing in your ears? Sinus infection? No sores in your mouth? Is there any problems, any other problems you would like to tell me about your ears, nose, or mouth, or throat? Okay. I'm gonna go into your eyes. Do you wear contacts?
Mm-hmm.
Are you nearsighted or farsighted?
Nearsighted.
Have you had any other problems with your eyes?
Mm-mm.
No blind spots? Any kind of like change in vision or double vision, blurred vision? No injury or pain? Okay. Have you had any nausea, vomiting? Is your stools normal?
Mhm.
When was your last bowel movement?
This morning.
This morning? Is it regular? Like you go every 3 days at least?
Yeah.
Okay. You don't go more than 3 times in a day, right? How often do you go?
Probably a lot. Once every other day or so.
No constipation, right? Do you have painful bowel movements?
Mm-mm.
No stomach abdominal pain? No stomach ulcers or anything? No
Nope.
vomiting? Have you had any blood in your urine? Difficulty urine, foul odor?
Nope.
Burning? Have you had any vaginal discharge? Kidney stones?
Mm-mm.
Have you had any sexual difficulty or sexually transmitted diseases?
Nope.
No urgency with urination?
Mm-mm.
No incontinence or urine retention? Okay. You have blood pressure. Is your cholesterol okay?
Mhm.
Even with your your high fat intake?
The last time we checked it last year, it was okay.
Okay. Do you see a cardiologist?
Once a year.
Okay. No irregular heartbeats?
Mm-mm. He says that sometimes I have the palpitations, but nothing crazy.
No AFib? Do you have any chest pain? No regular heartbeats. How is your muscles and your bones and your joints? Like, do you have any muscle pain or back pain?
Mm-mm.
Do you have any difficulty walking?
Nope.
Is there any joint stiffness or swelling? No muscle pain or tenderness or neck pain?
Nope.
Okay. Do you have any trouble walking? You don't have any blackouts, any loss of consciousness or anything? No difficulty speaking?
No.
No difficulty walking? You don't have any facial droops, clearly.
Mm-mm.
Any headaches?
Every now and then.
Okay. Do you take anything for them?
Usually just like an Excedrin migraine.
Okay.
Like
How
coffee.
often do you say you get headaches?
I don't know, maybe like once a week. Especially if I don't drink some coffee.
Okay.
Mm-hmm.
So how often do you take Excedrin? Just once a week with the headache?
Yeah.
And it relieves it?
Mhm.
Okay. How much is the Excedrin you take?
I couldn't tell you.
Do you take 1 or 2 pills?
2.
Okay. Any lightheaded or dizziness?
Mm-mm.
No memory loss or mental confusion? You don't have migraines?
Nope.
You never had a stroke,
Mm-mm.
no neuropathy or numbness or tingling.
Mm-mm.
Do you have any tremors? Any muscle weakness? Are you right-handed or left-handed?
Right-handed.
You never been diagnosed with depression, anxiety, or eating disorder?
I eat good.
Your breathing. You don't have any difficulty breathing, like when you're going upstairs. You don't get any shortness of breath.
I mean, if I start running upstairs, yeah, but I'm
Okay.
normally okay.
No asthma, right? No cancer. No coughs that won't go away.
I've got like this dry cough now, but
Okay.
nothing's coming
You
up.
never had any pneumonia or emphysema?
I had pneumonia last year, but not
Okay.
this year.
Any your skin? Any problem like with a rash or anything?
Mm-mm.
You have acne?
Mm-hmm.
Okay. You have any moles?
I don't think so.
Okay. Sun sensitivity?
Mm-hmm.
Have you had any hair loss or any changes in your hair growth? Any skin color changes? Do you snore when you sleep?
Not that I know of.
Any sleepwalking nightmares? Do you feel rested when you wake up?
Most of them.
Okay. Do you have any difficulty falling asleep at night?
Most of the time, no.
Do you fall asleep during the day?
Not unintentional.
Okay. Hang on 1 second. Do you take any over-the-counter medicines besides the Excedrin?
Just like a multivitamin.
You take a multivitamin? How often?
I try to take it every day.
Has your doctor said anything to you about your blood sugars being so high?
Not
That you
recently.
need to change your diet or anything like that?
Yeah, we've talked about that.
Okay, you're gonna work on that?
Probably should.
Okay. Do you take any herbal supplements either?
Mm-mm.
Okay. Do you have any problems just completing a task in your daily life, like doing the dishes, like walking around, anything like that?
No.
Okay. Do you have any questions for me? Okay. The doctor will be in here shortly.
Okay.
If you need anything, let us know, okay? Is that long enough?